Hi, thank you so much for having me today. My name is Jessie Flynn, and I am a clinical social worker by training and um, work in part-time in private practice doing psychotherapy with parents and young children, and part-time at the Red Leaf Center for Family Healing at Hennepin Healthcare. Um, I'm so grateful and just a privilege to be here. This is the second time I've gotten to be with this group talking about this really important topic. So just thank you to the coalition for inviting me to come today. We're gonna kind of dive into an important topic, a topic that can bring up a lot for us. So as a way to kind of start the meeting. And I just kind of want to start with a little bit of a invitation. That talking about race and racism and bias can be uncomfortable. I think particularly for me as a white person, I wasn't really taught how to have these conversations. And I think more so I was maybe taught to not talk about it. And so I have learned over time just and really tried to lean into some tools that have helped me learn and practice talking about these important topics. Um, and I think that I have learned over time that sort of the not talking about it is grounded in this culture of white supremacy that I, participate in, and we'll talk more about that as we go. And I have realized also that if I don't talk about these issues, that I don't have a chance of sort of recognizing, becoming more aware of my unconscious biases, or partnering in safe ways with BIPOC families. Um, and so, when I say white supremacy, I'm not just talking about people or groups that are explicitly racist, but sort of this white culture that we all participate in, myself, that is pervasive. And just to share a quote about that, to sort of explain that idea, if it's um, I assume not new to many of you and could be new to some of you. Honestly, it was new to me in the last few years. So that white dominant culture also operates as a social mechanism that grants advantages to white people, since they can navigate society both by feeling normal and being viewed as normal. Persons who identify as white rarely have to think about their racial identity because they live within a culture where whiteness has been normalized. I don't know about everybody's experiences, so I'll just speak to my own, that I certainly grew up thinking I don't have a culture, that it was other people, particularly people of color that had culture and I didn't. I realize now that that was part of this white supremacist culture, and that my whiteness and white culture is normalized, and anything different is considered culture. Of course, we know that there's a lot to white culture, and I am still learning. So I come to you today not as an expert, but someone who is learning and still struggling. And I hope we can enter into this with that um, piece, and that we can lean into this idea that we can experience discomfort, but also be safe, um, which can be tricky. It has been tricky for me. So, and I think just for me as a white therapist, trying to lean into that work ultimately so I can be a safer partner and therapist working with families with very young children. So with all that said, I want to give everyone lots of permission, to the extent that feels possible to you, to engage in this today. Some of you, if I have some movement physical therapy or colleagues who talk about that, I think this comes up in yoga culture, that like healthy edge, where too much more might feel unsafe or not good in our bodies, but much less won't help us move and grow. And so I like to think about that idea for myself when I am doing this work. So I will share my screen here and pull up my PowerPoint. play from start. Is that good? Can people see the PowerPoint? Okay, thanks, Kati. Okay. Whoops. Okay. This is sort of a landscape of where we'll go as over this next hour together, beginning by grounding ourselves in reflective practice, that sort of tenet of infant and early childhood work, and then sort of dabbling in some of these ideas around how to have these conversations, how bias shows up in our parent-child assessments specifically, and then this idea of de-biasing. How do we, move forward in this work of trying to de-bias ourselves? So you have heard this. I know this coalition has engaged in a lot of training over the past probably more than year. And I would say that I'm going to close this. Now it means I can't see anybody's faces, but I'll try to hold. This is so hard about Zoom still, right? When you can't see everybody. So I guess to also bring up the idea of repetition in this work. Certainly in therapy, we do a lot of repetition. I think it's how we learn and grow and heal. And so there will be repetition today because I know all of you have been engaging in training and your own individual work and with your teams. I just invite you to be open to the idea of repetition and how that helps us learn and grow. So just to start with that simple definition of what is unconscious or implicit bias is also used. I liked this definition, attitudes or stereotypes that affect our understanding, actions, and decisions in an unconscious manner. These biases are activated involuntarily and without our awareness or intentional control. And so I think for me, this helps settle some of my anxiety about it because we all have it. And it sort of shows up involuntarily and without our control or awareness, which can make you feel anxious too. But at the same time, to recognize this is just how it works helps me feel a little bit less anxious about it. I think it's unconscious bias is particularly problematic for those of us who identify as white because we are also backed by systems of power and privilege that have led to and continue to harm BIPOC communities. So for me, it just adds a sense of urgency to intentionally engage in this work of becoming more aware of my biases. I found this, which when are we most susceptible to unconscious bias? So when we have ambiguous or incomplete information, when we have time constraints or compromised cognitive control, like fatigue, stress, high cognitive load. And I thought, as home visitors, when are these conditions not present? And so I think also to normalize that there's we always only I don't think we ever have the full picture or all the information possible. There's always information we don't have. I know everybody is fatigued and has, a lot of stress and time constraints and all kinds of pressures on them. And so just to normalize that we are all susceptible for this, particularly in these intense roles that everybody has. So sort of grounding us in reflective practice, again, one of the anchors of our work in infant and early childhood mental health. I feel like I have to see somebody's face here. I just thought I would define reflective practice for us. In work with parents with very young children, we think about reflection as being so vital to our work because relationship-based work elicits so much for us as providers. And we also kind of lean into that parallel process that if we are supported as home visitors or providers or whatever our role is to reflect on ourselves and the work, that we can then more support parents to reflect on themselves and their parenting so that they can be more reflective of their children, right? All the way down. And so reflective practice is this way of working that spans disciplines and encourages us to consider the possible implications of our interventions while in the midst of the work, slow down, filter our thoughts, and more wisely choose actions and words, deepen our understanding of the contextual forces that impact our work, and take time afterward to consider our work and related experience in ways that influence our next steps. I would say I love reading this and reminding myself of it. This is really hard. It's really hard to engage in reflection in the midst of the work. And I also think, whoops, I have recognized, I would say, I think since 2020, since the murder of George Floyd, I had not really considered, I had a lot of training in infant early childhood mental health. I had not really considered how much of that research had not adequately explored the impact of race and racism. Um, Honestly, since 2021, we're starting to see more and more of this in the literature. That's only a couple years ago. And we haven't really had guidance on how to, yep. Was there a question? No. We haven't really had guidance on how to support reflective practice in a way that keeps race on the table and helps us become more aware of our biases. I know I have provided reflective consultation in the early childhood space, and I have felt like I'm in uncharted waters in respect to how to support racial equity work in the reflective practice space. So one of the things that I have been exposed to, and I don't know if some of you have, because I did some mental health consultation in the schools, they use Courageous Conversations About Race by Glenn Singleton as a way to sort of help provide some guardrails and supports around how to have courageous conversations about race. And I have leaned into this because I think it provided me some of the guardrails that I feel like I didn't have, particularly in providing reflective consultation. So I offer it here today as a way for us to engage in this work today. And they say there's three critical factors for achieving racial equity. One is passion, and I know this group is full of passion. I feel like infant and early childhood providers have the most wonderful passion. I just feel in such good company with our infant and early childhood providers, and particularly home visitors, because I think you're our front line of infant and early childhood mental health. Practice. So I know you have been engaging in these trainings, and I'm sure work within yourselves and own agencies, that it takes practice and ultimately persistence. And I will say, I'll just share a really brief story. I had a really difficult experience providing mental health consultation within an early childhood school setting. You can see bias all over here. I made the assumption that having the school's racial equity coach join us for reflective consultation would be an amazing way to keep race on the table, to keep me accountable as a white reflective supervisor with a predominantly white early childhood staff. And so I just made that assumption. And there was huge reactions from the participants. And Laura and I actually talked about this yesterday, that the idea that people felt very vulnerable, like, how do I reflect on my biases within my work setting and that not reflect poorly on me in performance evaluations? It got just very tricky and difficult. And ultimately, the racial equity coach was asked not to come. The unfortunate part was she was the only person of color. and so the impact on her was pretty significant to be asked not to participate in these meetings. And I decided to sort of say, I can't provide it if she can't be there. Again, my own, biases and assumptions and messy attempts to try to support her and this work. And it got very difficult. And I would say that my first instinct was, I'm out. I can't do this. It's too hard. I want out. And the racial equity coach, a woman of color, like extended me more grace than I deserved and sort of said, Jessie, if you're really going to be a champion for anti-racist work, you can't give up as soon as it gets hard. And boy, was that a wake-up call to me, to persist even when it feels really difficult and messy. And so I will say that for me was a big aha moment and a call, to persist in the work. I don't know, maybe because I have this up here, you can't see it, but the Courageous Conversations talks about these 4 engagements of courageous conversation, and I added in learning. The first is to stay engaged. That speaks to that idea of persistence, to stick with it, even if it's hard, to speak your truth, to not speak for other people, but for yourself, to experience discomfort, just the assumption that we will experience discomfort. And this last one of expect and accept non-closure, that I think I know I have felt like, gosh, I wish I could tie this up, the example I just gave, in a way that feels resolved and better, and like we can move forward in this really positive way. And I would say that there was a lot of non-closure, that it didn't get wrapped up neatly in a way that felt really good to me. And I think, at least I have found, that is often the case in these spaces. So just to give you me to pause talking and to give you a little bit of space, I was hoping Kati could put you into groups of about 4, and just reflect on these questions. Again, I give you lots of permission to share as much or little as feels comfortable to you. But thinking about this idea of, during a conversation about race, have you ever experienced disengagement like I shared? And how did that impact the dialogue or the situation? Have you ever felt discomfort? And how did you either work through that successfully or not? How do you feel about this idea of feeling discomfort is different than feeling unsafe? And why is it necessary to expect and accept non-closure? Those are a lot of questions. I would say your group could pick one, because I'm just going to give you a few minutes here to discuss amongst a small group. So I think I will copy these and maybe drop them in the chat. Oops. And then we'll just start off that way. Does that sound okay? So maybe just a 5-minute check-in, just to start to engage around these ideas of staying engaged, experience discomfort, speaking your truth, and accepting and expecting non-closure. Would that be okay? Okay. Maybe one or 2 people wanted to share back a theme or a takeaway from your just brief check-in with some colleagues? I can just share one from ours, which was just that we like just the practice of talking about it feels productive and helpful, particularly when the issue feels so big. But just the recognition of like practicing talking in these ways and in these spaces feels productive and helpful.
I can share one really quickly from our group. Anna was talking about a tense situation, not knowing exactly how to respond when someone said something that caught her off guard. And what I valued and what she shared is how she chose to pause, and not immediately jump in. And I think that's a good chance for all of us because it might even signal the other person like something's not quite right here, but then also gives you a chance to collect and gather, prepare to engage and on the best foot forward possible. So thank you, Anna, for sharing that.
Yeah, I love that. It's such a mental health uh thing too that we work on, to create that pause between an experience internally and our sort of reaction. I love that. Someone else wanted to share?
I liked what Jen said about giving yourself permission for folks who know about racism or are learning about racism to come to terms with the fact that it's not a closed conversation. There may not be closure in each conversation you have about racism because there is continued work to be done.
Yeah. Thank you so much. Yeah. Um, to that end, our group just talked about how we don't often leave these conversations or events or interactions feeling really amazing, and as a white person versus a person of color, how that shows up, it's difficult work, but as we know, so important. Thank you everybody for engaging in that way. I'll go back to share my slides here. Okay. So in terms of parent-child assessment, and again, some of these we talked about when I was with you before, if you were here, but I know that in home visiting you look at child development screens, parent-child interaction assessments, and then parental well-being screens. That we draw from both formal screening tools and informal observations. And we use this assessment data to inform our decision making about intervention with families. And as we know, despite evidence-based tools, extensive training, access to expert consultation in some cases, bias are very present in our assessments. And I just think about how so many of our screening and observational tools, you know, have been developed by white researchers and clinicians. Like I just put in some of these recently to check, and from what I could tell, their developers were mostly white. Um, and as I said before, issues of racism have not been a focus of attachment-based assessments and interventions really in the literature until 2020, that we started to talk about it a lot more. And so we just have a lot of work to do. And so in my mental health, I use these parent-child interaction assessments. One is from Attachment Biobehavioral Catch-up. It's a mental health therapy, dyadic therapy, if you're familiar with it. They have a play assessment to get an idea of how the relationship is working for the child. Also in parent-child interaction therapy, they have a observation tool called the DPICS, or the dyadic parent-child interaction system. Sometimes I'll use the ASQ that have the parents sort of do the ASQ with their child while I observe. There's also one called the PROL. They have some guidelines to them, but I would say there's a lot of potential for me to make meaning and sense of what I see within my own lens and experience. I don't know if these are ones that you use. These are the ones on the Minnesota home visiting website. I don't know if people can let me know. Are these the tools that you're using for sort of interaction assessment, or are there other ones? I don't know if I can see the chat, but just at first glance of these were developed by white authors as well, just to say that. ASQ. Okay. Okay. So I think just for me, just to bring that to my awareness, I shared this recently. Like, again, I did a recent talk with pediatricians, and I was going to recommend some books about parent-child, and infant early childhood mental health. I realized they were all by white authors. That's a big problem. I don't think that would have been within my awareness, um, prior to a few years ago. And so we just have a lot of work to do, myself included. I shared this before, but I liked this sort of ladder of influence um, image about how we come to take action with families, and that we start off sort of this pool of observable information. We make observations. We use some, again, formal screening or informal assessment. We make meaning from these assessments. We make assumptions based on those meanings. We come to conclusions that inform beliefs, and ultimately we take action. Um, and so to think about all the potential ways that bias or our own experience, training, lens can show up in these different steps between meeting with a family for the first time and then, working towards intervention and support, all well-meaning, and yet if we aren't aware of how our biases show up, right, we can and have harmed families. And so I added this sort of thinking about that assessment and decision making and taking steps all within the surrounded by your own or my own cultural and racial lens, and of course also my training experience, but that all informing how I make decisions. The Courageous Conversations About Race protocol offers this compass, they call it, and they talk about that there's 4 ways that where'd that slide go? Okay, well, I'll just have to describe it. There's 4 ways that we process, you know, information in the racial equity space. One way is through emotional response, that we have a significant feeling come up in relation to the information or interaction. Another one in the top quadrant is this sort of moral, that we have strong beliefs that come up and surface to the top when we engage in these kinds of conversations. We can show up in our thinking brain, like we want more data. We want to think about it really cognitively, kind of separate from a feeling about it. Or they call it a relational or acting way. We want to take action. We sort of want to do things about it. And so starting to think about, as we think about kind of our own awareness of ourselves, locating ourselves on the compass when we engage. So just thinking about these first few slides about assessment and bias. This is where Kati is hopefully going to be able to put up a poll for us. But where do you initially locate yourself on the compass after listening to these slides about how bias shows up in our assessments? And just sort of your gut reaction would be great. Is everybody seeing do you think I have to stop sharing?
I see some folks answering. We have about 30 responses now. So
oh, great. Okay, I just can't see that.
Wonderful interaction. And I can give it about 20 more seconds for folks to think about, or until we get full robust participation, whichever comes first.
I don't see the poll. Where are people seeing it?
For me, it just popped up.
Yeah.
If it didn't and you feel comfortable, you could put your answer in the chat. It'll have your name attached to it, of course. That's why we did the poll. But if that feels okay, you could do it that way if it didn't pop up.
Mhm. Yeah.
Okay. So about half emotionally, like we have a feeling about it, some intellectually, like wanting to more think about it, some having strong beliefs about it, and some like ready to take action in some way. Um, I think lovely. And just to show like the diversity of experiences, this is what I expected, is that we have different reactions. None of them are right or wrong, but just particular to you, and just the recognition of that and how you show up in this space. Okay. Okay. Oops. So starting to think about like, so how do we support de-biasing? This was actually a new word to me. Of course we talk about like becoming more aware of our unconscious bias. I love that they made it a verb, like de-biasing, and came across this list. So one is sort of to recognize when we get into stereotypic thinking and actively work to create new associations. And sometimes that can be from exposure to individuals with counter stereotypes. I think an example that I have thought about is like this idea of who is a white supremacist. I think who comes to mind, like stereotypically for me, is a person with like, a white person with like no hair, um, you know, kind of like that sort of person. And I don't picture someone like me. Um, but I think that in the way that I am unaware of how I participate in white culture and white supremacy, um, I think I need to start thinking about people that look like me and myself in that way. And so just countering those stereotypes, increasing intergroup contact, education about unconscious bias, which of course this group has really been diving into, accountability, which we'll talk more about. And I know this group has talked about when for bias, um, understanding others' viewpoints and increasing empathy, and that self-monitoring, self-reflection piece. I love that piece because I feel like that's where I have the most agency. I can't always control everything else, but I really have a lot of agency in certain terms of increasing my own awareness of myself and how I show up in these spaces, and with awareness of myself. So I thought we'd spend a little bit of time there and sort of continue to practice this idea of self-reflection. You've heard about the difference between cultural competence and cultural humility. For me, this was a really impactful shift in terms of my work, because I think my training was largely about the importance of learning about others' cultures. I didn't consider how important it was to really start with an examination of my own beliefs and identities. And so really trying to lean into that as well. The Courageous Conversations About Race offers this idea of creating a racial autobiography. And their question is, what can you recall about the events and conversations related to race, race relations, and/or racism that may have impacted your current perspectives or experiences? I did this, and you've seen this identity wheel. I think sometimes tools like this can help us sort of be able to see and pull out what just feels like just a part of us, just to separate it out a little bit so we can actually look at it and examine it. This definitely helped me think about my different identities and how they intersect, my racial identity being one of those. And I thought I'd just share a little bit, and I shared this actually before, so it won't be new for some of you, but I think this is what I've learned about myself, that I grew up in a white, middle class, largely Protestant educated, heterosexual, cisgender family in the suburbs of Columbus, Ohio. The suburb I grew up in was 86.5% white. No households reported non-English language spoken. and the poverty rate was 1.82% compared to like the national average of 11.4%. So this was the large part of my upbringing. And I think my early experiences with BIPOC communities was largely driven by my father, who was the only white member of this interdenominational ministerial alliance. He was a minister and, was a part of this group as the only white minister. And so I had some experiences from a young age of not being the predominant race in the room, although it was few experiences. Usually in my upbringing, I was the dominant race in the room. My first experience of being a non-majority was when I studied abroad in Latin America, but I realized like my sort of blue eyes were sort of lifted up as desirable, and so it felt like a privilege, and not a hindrance, my racial identity. I have talked a lot with my dad about our family, our ancestors. There's really painful, difficult history on particularly his side of ancestors being involved in evidence of participation in chattel slavery and other racial violence that our family, particularly me and my dad, have really tried to learn more about and understand and reckon with. I think the things that I've realized about myself, that I've had little experience feeling uncomfortable in a group due to my race. I have only recently come to recognize myself racially and culturally. And that I definitely used to subscribe to the belief that I was like one of the good white people. And therefore, I never had to examine any of these things or how I show up in these spaces in ways that might be harmful. And I think my educational experiences emphasize cultural competence, not cultural humility. So with all of those things, I think I have to realize that this work is urgent. It's intentional. It has to be intentional. It has to be daily. And I am going to need support for it and take a lot of accountability myself. So I don't know if people have done that, but I've seen people write poems. I've seen people put together images of just a way of exploring, kind of your own racial and cultural history, has been really powerful for me. Okay, so we're going to check back in sort of where we are using the compass. And I thought I'd just share a couple things and just see where people register, just all within the spirit of like building self-awareness in this space around racism and bias and self-awareness. So when I say, in this country, this is a quote by Toni Morrison, in this country, American means white. Everybody else has to hyphenate. If we could do the poll again, where do people initially locate themselves?
Allison, did you see the poll this time?
No, maybe it's just my Zoom.
I'm not getting it either, Allison. So I'll put mine in the chat.
This is Holly. Curiously, I just got the first poll to pop up.
Huh.
It's really fun though when you see it.
Okay, I'll give everybody 7 more seconds.
Okay. Somewhat kind of similar split, but really lovely. Again, just the diversity of responses and how we show up. Okay, I'm gonna say another one. Being white does not mean you haven't experienced hardship or oppression. Being white does mean you have not faced hardships or oppression based on the color of your skin. Nice. Thank you, everybody, for responding. And again, the exercise is really just to check in with you and to recognize we process these kinds of things in different ways. I'm going to skip it, but I will share just in the service of time. I'm going to share it though. I don't know if some of you have seen this spoken word. It's about 4 minutes. It's a spoken word artist who has shares about how to explain white supremacy to a white supremacist, to a white person. And he talks about white supremacy is not a shark, it's the water. This idea that it's not the really obvious sort of dangerous person, explicit. It's more the water that we swim in. And it's a really powerful video. And so maybe Kati, you could drop it in the chat for me. Okay, if you haven't seen it, I really encourage you to watch it. And then just, again, you could use the compass to just check in like where that shows up for you as you process what he says. This was shared with me by 2 racial equity coaches who created the Hope Speaks project that just works on racial literacy, racial equity literacy, and a really powerful spoken word example. Okay, so if we're all, very vulnerable to unconscious bias, if it happens to all of us, then what happens when we unintentionally harm? Because I think the difficult message is that we will. I know that I have. And so Resma Menakem, again, just kind of leaning on some of these leaders in this area to help us have some guardrails and engage in this space. He talks about these 5 anchors when tension arises. And I don't know if this group has, I'm sure many of you have read his book. There's so many good pieces in there for us, but I just thought I would read them and just the reminder. So when tension starts to rise, to soothe yourself, to quiet your mind, calm your heart, and settle into your body, right? That these are largely body-based experiences. To notice the sensations, vibrations, and emotions in our bodies instead of reacting to them. I like any sort of body-based work too, because those of us in infant early childhood know that like babies first experience feelings in their bodies, right? They don't have the language yet to talk about them. And so, but by us noticing how a baby is feeling in their body and by putting language to it, babies start to have that sensation. And then as they develop language, say, I feel sad when they have that feeling. And so I appreciate that parallel process of us as adults just coming back to the body. accepting the discomfort, which kind of overlaps with that courageous conversations about race idea. Notice when it changes instead of trying to flee from it. Staying present and in your body as you move through the unfolding experience and respond from the best parts of yourself. And then he says, safely discharge any energy that remains. And there's lots of different ways to do that. Sometimes movement is a great, like even just doing this. I will say, and probably many of you resonate, this is really hard. It's really hard to do that. I think I often want to flee. I want it to be over. I want to shut down. But just sort of, I like this reminder of sort of tuning into the body, which again speaks to our work in infant early childhood mental health. Kind of one of the famous sayings is like, when there's affect in the room with a family, the first one to regulate is yourself. The first affect to address is yourself. It's really hard to do, but I think for me, when I start to feel anxious, whether it's in, conversations about race and racism and bias, or whether it's with a family, that's, when there's activation and affect, to ground myself first. Really hard to do, and I'm still working at it. And then, of course, another grounding piece, and I know this group has worked with this idea of rupture and repair, but it's foundational in infant and early childhood work. I liked this graphic that said sort of rupture is, when we don't know how to, that rupture happens, right? It's sort of like how unconscious bias happens. We are going to have ruptures. Healthy relationships have ruptures. The problem is when we have rupture without repair, right? For us as, home visitors and providers, but for also in the parent-child relationship. So not knowing how to repair leads to playing it safe. I think we talked about this a little bit in our group. The fear of saying the wrong thing maybe keeps us quiet, but what does our silence or quiet, what's the impact of that? And that, it's more shallow. Our relationships are more unsatisfying when we always play it safe. So if we lean in, if we take some risks, and we mess up, often unintentionally, or we say the wrong thing, I know that I have, that we can repair. And this one says repair is more than I'm sorry. It's also naming it happened. If any of you have read Dr. Judith Herman's new book called Truth and Repair, she wrote she's a big trauma clinician and researcher, and she has a new book this year, and she talks so much about how trauma survivors need that acknowledgement of the harm that happened to them. So naming what happened, owning our role, naming the impact. This is where that idea of intent and impact, we didn't intend to harm, yet we can recognize the impact that felt harmful. And then planning a way forward together. Again, sticky, messy, vulnerable work here. And then I know this group has also thought about this idea of calling out versus calling in. I think this speaks to that, like, how do we, like, the accountability for bias? We have to have a way to help ourselves and each other be accountable. It feels really scary, but we have to have a way. So particularly so that we can be less harmful, particularly in spaces with BIPOC families or colleagues. And the idea that both are important, I think there's probably been an overemphasis on calling in as this invitation to one-on-one or small group conversation to bring attention as like safer and more respectful. But I do think calling out is sometimes equally as important, that it's more of a bringing public attention to harm. And so I think holding both as things that need to happen and can happen. I also was told by those two racial equity coaches that I learned so much from, that it's from a book. I don't know which book it's from. Maybe some of you do. But this idea that if you get called in or called out, could we consider thinking about it as someone telling us we have toilet paper on our shoe? I recognize that that feels sort of ridiculous and maybe too simplistic, but like if someone told me I had toilet paper on my shoe, I would say, "Oh, thank you. I had no idea." And can we get to a place where when someone calls us in or out, to say, "Thank you. I had no idea. You know, tell me more." Or how, so I'm trying to lean into that. It's super vulnerable. But that idea of toilet paper on my shoe helped me. So I offer that, and it's from a book. I'm just not sure which one, as an idea. I'm just going to check my time here. Okay. I think we'll skip that. I think I just wanted to end on the tenants, which again, I know this group knows about. I appreciate them as, again, guardrails for engaging in this important work. I think it's been really helpful for me, and I think it's helpful for us as individuals and agencies to have these guardrails, and I hope we continue to have more guidance in this area. These are the tenants 1 through 7. And I think just to recognize, I said I work part-time at the Red Leaf Center for Family Healing at Hennepin Healthcare. I would say we are struggling with many of these right now. That recognizing and respecting non-dominant bodies of knowledge, we have work to do there. Honoring diverse family structures, we certainly welcome see patients, LGBTQ patients, and yet our partial hospitalization program is still called the Mother Baby Day Hospital, and many parents don't identify with that word mother, and so we're learning and struggling in these areas. Supporting families in their preferred language, we do a lot of group-based programming. That's really hard to have interpreters in the mix and to have group cohesion. So I think just to acknowledge that that there's work to do, and I myself at the Red Leaf Center, we're struggling with some of these things. And so kind of this temperature check for yourself, your agency, your team. In what ways are you really living out the tenets? In what areas is there room for growth? How might you take steps in the areas where their growth is possible? And then who can be accountability partner for you? Again, being really intentional and persistent in this work. I've recently been sharing this quote from Dr. Jerry Paul. She was like a champion in infant early childhood mental health. And she said, "We learn over time that everything we know is a hypothesis, that we have ideas, but that we don't have truth." I think this has been really helpful for me, particularly when I feel anxious in this space, either in interactions around race and racism, or working with families, that I don't have truth, and that helps me sort of settle into the work, be more curious, and be more regulated myself.